Good afternoon, everyone. I'm Jo Walton, and I'm a carer, and this is Sarah, my daughter and constant companion. I'm sorry not to be able to be with you in person this afternoon. I really wanted to join in the discussion, but my responsibilities mean that I can't. What is a carer? The NHS definition of a carer is anyone, including children and adults, who looks after a family member, partner, or friend who needs help because of their illness, frailty, disability, mental health, or an addiction and cannot cope without their support. The care they give is unpaid. A carer can be a user of care services. Current estimates are that about a quarter of carers have a disability, but they are not care workers, as they are not employed to do the role. It is important when governments are referring to carers that they do not confuse them with care workers, who are also important parts of the care service community, but are different. There are many carers in this country. The most recent census data puts the estimated number of unpaid carers across the UK at around 5.7 million. This means that around 9% of people at any point in time are providing unpaid care. This is almost 1 in 10 of the people in the UK. It's also likely to be an underestimate, since research would indicate that as carers we can take as long as 3 years to realise that that is indeed what we are. Every day, around 12,000 people take on new caring responsibilities. 4.3 million people a year. Our journeys into caring are as unique as our situations. It can be a sudden, unexpected occurrence or a gradual process. We don't apply for this job, the job finds us. For all of us, it marks a substantial change from what our futures would have been, and whilst it brings great personal fulfilment, it also means great loss for those for whom we care and for ourselves. 1.5 million of us provide more than 50 hours of caring a week. As a result of the work we do, the value of carer support is a staggering £162 billion a year. We all have a profound and positive impact on those we care for, society and the wider economy. Why then are we so regularly ignored, or worse, seem to be labelled as scratchers or work shy, and many forced into poverty? We have no choice but to care. There is no adequate alternative. Many of our issues are issues for those who use care services and those who work within care services. We need good quality, accessible information, which is clear, intended to inform, not to prevaricate and confuse. It needs to be there at the start and all the way through our caring experience. We need professional service support, assessments which are clear and objective and co-produced. We need advocacy, which is sensitive to culture and language to help with the process. We also need an acknowledgement that for many, this lifelong commitment is tied to the lifetime of those for whom we care. Carers may need help adjusting after the care is over. Equally, the need for care may go on after our ability to care is over, a nightmare that many of us live with, and one for which we should be able and supported to plan. We demand practical support. In short, we need a flexible care support and independent living service, and we need it now, not in 10 years' time. The time for research, reviews and consultation and investigations is over. National care is in crisis. We have all been collectively waiting over 75 years for it, and every time it has seemed a possibility, it gets kicked down the road again. Many carers give up their own careers to care. Many exist on benefits in households where the household bills are far higher than for those in the general population. The role which we take on out of love should not be an excuse to force us into poverty, but a reason to ensure that we are properly supported financially to enable us to carry out that role. And finally, we want equality. We know those we care for better than any paid professional, and this should be acknowledged by all. There should not be any fear of retribution for pressing for professionals to do their jobs, which should be a protected characteristic. have free access to the Court of Public Protection, and enjoy 360-degree accountability with all those involved in the care and support of those we love. I would love to introduce you all to my daughter, Sarah, but there isn't time. What happened to us could happen to anyone in this room at any time. Be warned, carers have found Zoom and we won't be quiet anymore. Thank you for listening.